morning, Christie.
It's wonderful to be here on the backdrop of World Health Assembly 79 here in Geneva. So unfortunately, climate and health is not necessarily on the agenda in a big way this year, but that being said, NCD Alliance are producing a new report that's going to be published this week talking about the impact of air pollution and different policies that can impact clean air. So it's really, really positive to be able to have this discussion with you today, really talking about the impact that climate can have on health.
Exactly. I think it's really important because it concerns right from the time a child is born. I think before the child is born, from that time, from a pregnant mother to the vulnerable till the aging population, everybody is affected by this. And I think these surveys and these the policies that we make around are really imperative for each and every country around the globe. And I think it's very powerful, and I think it should create that ripple effect and reach out to the grassroots levels of all countries.
So, I mean, it would be great to hear about your experience in India and the work that you're doing on climate and health.
Yeah, so I think that climate and health cannot be now talked about in silos because they are connected. And if we talk about NCDs specifically, it's important that we address these issues. I'm an educator by profession, and I can see that climate anxiety in young children also. So when we are talking about sciences, when we are talking about environment, they are talking about the anxiety that, they say why this, and there are a lot of whys. But it's not about only whys, it's also the how and the hope that we can do by our own actions. So it's very important that individual actions have to be taken, and that's how we can tackle the mitigate air quality problems that are there in India and globally.
Absolutely. And we really have a big health literacy problem when it comes to air pollution, don't we? I think that's very poorly understood, the impact that air pollution can have on health, not just everyday health, but it has a major impact there, but in terms of long-term health and the impact that it can have on non-communicable diseases as well. So to tackle and prevent NCDs, we really need to be focused on air pollution.
Yes, I think we have to create awareness, and it's also misunderstood in a way that there's also indoor air pollution and outdoor air pollution. And India being a mixed country with the rural and the urban population, it's a lot that we have to reach out to the grassroots levels, and because it has got provinces with different languages, there's a language barrier. So we need to create an ecosystem where this has to be, this has to go to each and every. It's not only about the government, it's also about the women in the house. Mm-hmm. It's also about the, the men in the house or the children in the house. It's about the entire community. Each one has to pitch in to make the global difference.
Absolutely. And we need to have different ways of communicating this information to the individuals most impacted. I think that healthcare professionals play a really important role in educating individuals on the impact that climate can have on their health. And so at Halion, one of the things that we do is a program called the Care for Every Breath program. And what this does is educate healthcare professionals on the impact that air pollution has on health so that they can have those informed discussions with their patients and help mitigate those impacts.
Exactly. So I think what the healthcare professionals are doing are they're treating the diseases, but then as caregivers or patients themselves, it's important for them to look around them and read the situation around them and then take informed decisions.
Absolutely.
So that they pitch in and they are, they are well treated. So climate does not come into their way of their treatment.
As an educator yourself, Seema, it would be amazing to hear about the work that you're doing with the young people in your community.
So we in India, we have devised one program which is known as the Green Campus Program. And in this program, we target 5 main domains of biodiversity, air, waste segregation and management, potable water, and how to treat the wastewater. And there's something which is also called innovation in their own way. So these children they're taken for a field trip beyond their books, and they are kind of hand-holded to understand the nuances of each and every domain, and they uplift their own home front and also right from their classroom to their school community, and then they go to their outside community, transcending the boundaries of their school and touch the community around them. So that's how, and it's been really, really successful, and I'm very proud of it.
Yeah, it's amazing work, and I think particularly down to the fact that the impact of air pollution is not equitable. it impacts those on lower incomes, it impacts younger people, and it impacts older people more significantly than other groups. So to really target those communities that are being impacted the most, and educating them, and then they can take that information back to their families is really, really important, because they can become advocates in their own right.
Yes, they're the young ambassadors, and they're the unsung heroes, but they take the message to their homes, to their communities, and come back and share with us, and it's really rewarding.
Absolutely. But to move us slightly away from the individual responsibility and to think more broadly about the collective responsibility, I think it's really important to recognise that when it comes to measurement of air quality, is a very embryonic area of research and measuring compared to carbon emissions, for example, where we're very, very established. And companies like ours have got very clear guidelines on how we report our carbon emissions, and most importantly, how we reduce our carbon emissions. Whereas with air quality, there is no set standard yet. And it's really important that we have clear ways that we can measure air quality, because it allows us to make informed decisions within our supply chain that can ultimately reduce the level of pollutants in environments. And actually, we've been doing some work with the Alliance for Clean Air and with technical support from the Stockholm Environment Institute to be able to measure and map and disclose our air quality. We've been disclosing that now since 2023, and it really does give us the information that we need to make informed decision about the pollutants in the environment, because it doesn't ultimately just come down to individual responsibility. It comes down to the responsibility of all of us. And as you mentioned at the beginning, it's about not working in silos. It's about working together to tackle this area.
So when we talk about the government also, there were times when the air quality index had really risen in Delhi. The government had come up with the plan of running only the cars with the odd numbers and the even numbers. Okay, there is a metro day where the companies had to tell their that they have to go in for carpool, or there's a metro day. All of them will observe metros to travel and not their cars. And also if government decides on stricter saying no to the fossil fuels and shifting to EVs and solar run cars, I think it's on the way. Very soon, I think everybody is going to make a difference. Work is going on, and people are also conscious, and they are shifting from the petrol and diesel to EVs now.
Yeah, it's very important to consider what's happening in India and these sorts of initiatives. Ultimately, some work that we're doing as well is to look at air quality index and predict when that index is going to be particularly poor for a given day, and that is when we target educational materials to say that the impact that air pollution can have on congestion, for example, and the role that nasal decongestion, the reducing nasal decongestion can have on the impact of air pollution. So I think that's really, really important as well to discuss. But to round off the discussion, Seema, what would you ask governments and stakeholders to do now to help reduce the impact of climate on health?
I think that the government has to come down with stricter policies, and each and every stakeholder has to follow the rule book, whatever is set, so that we meet the objectives that are being set. So there are a lot of survey and a lot of research that goes in before all these policies are rolled out. So I think just following the book and the rules that are being set by the government is going to help each one of us.
Absolutely. I have to say, these discussions always really, really inspire me to think about what more we can be doing, and particularly and particularly looking at the work that you're doing within your community to really create a new generation of advocates. And it does make me think that we've got a lot of positives to look forward to in the future. And we're really seeing a lot of momentum about the discussion on climate and health, and more people understanding the impact that climate is having on health.
Correct. And we together can replicate certain models which will be, can be tweaked and followed by other nations also.
Absolutely.
Thank you so much.
Thank you.